after the first phase, or even during that, we will be working with partners to help in the distribution of the vaccine. Now, for the director and commissioner speak, I want to say to you that we have over 17,000 confirmed cases in the city of Cleveland over this 10-month period, and we have 180 deaths. So I want to express that the pandemic is not over. It is not over. Even with the vaccine becoming available, the pandemic will not be over. So it is very important that we continue, even with the vaccine, continue to follow the basic rules. That is, stay at home unless you absolutely have to go out for essential purposes. If you go out, wear a mask, keep social distance, and wash your hands constantly. So I will turn it over to Director Kimball, and then he will turn it over to the commissioner, and then we'll follow up with your questions. Thank you.
Thank you, Mayor, and good afternoon all. I'm Brian Kimball, Interim Director for Cleveland Department of Public Health. The Mayor made a good point. The pandemic is not over. This vaccine that we were in receipt of is just one more tool in our tool belt. We still have to adhere to social distancing. We still have to wash our hands frequently. We have to follow all the rules that are necessary to keep us safe. And we have to always maintain our mask. So as we move to this next phase, we'll begin to provide vaccines to those that are our frontline workers. We are in receipt of the Moderna vaccine. The Moderna vaccine, we're ecstatic to have that. Again, it's one more tool in our tool belt. The Moderna vaccine we're in receipt of. We'll store this. We're not required to, this does not require our sub-zero storage. So we are able to store this in our normal laboratory refrigerations. The Moderna vaccine can be administered to individuals 18 years or older. And as we move into our first phase, our goal is really to reduce the spread. We have priorities set by the state and the CDCs for our first phase. Those are residents that live in, residents and staff in nursing homes, residents and staff that are living assisted living. In addition to that group, we are also focused on people with persons with developmental disabilities, those with mental health disorders, including substance including substance abuse disorders. Those persons that are living in group homes, residential facilities, or centers and staff in those locations. In addition to that is our EMS and EMT workers, and that is the group in which we're going to start with. On Thursday of this week, we will begin to provide vaccines to that group. These are our primary, this is our first initiative, and as we move on through the phase 1A, we will be identifying other groups to provide the vaccine to. As the mayor mentioned, long-term care facilities. There are a number of long-term care facilities and congregate livings that are registered with the state or federal programs, and the vaccines will be provided to them through that program. The others that are listed, or that I listed, will be our responsibility. As we get closer to identifying the next group that we will be providing vaccines to, we will be communicating that information out to the public. So with that, I'm going to turn this over to our Commissioner, Pat Cusick. He's going to go over some of the details around how we're going to distribute the vaccines to our first line.
Thanks, Commissioner. Thanks, Mr. Mayor. Hi, I'm Pat Cusick. I'm the Commissioner of Environment for the Cleveland Department of Public Health. I formerly worked in emergency preparedness, so we've been planning to distribute medications and vaccines to the entire population of Cleveland for 2 decades now. We are rolling out what's called a point of dispensing or a vaccination pod to touch the first responders. We will be working through the approximately 1,200 individuals who fill those roles and fit the CDC criteria in this first vaccination pod. So we will work with scheduling and getting those services in so that they don't impact services to the community during that. These are our first responders and they have very heavy responsibilities every day. We will staff the pod with Cleveland Public Department of Health employees who've done these roles, and we have done a training and orientation for those individuals who will fill those roles. As we expand these operations and have additional vaccine and additional groups we can give it to, congregate facilities and some of the other agencies that do support services, we will be expanding each one of these. Every level that we expand, we will staff up and follow these same procedures so that we can get all of the public vaccinated as the vaccine becomes available for each of those groups. We anticipate getting the flow through, the very first groups through, in with their scheduling so that we maintain city services over a 6-day period. And we will take any questions and address those issues as they come up. Thank you.
Okay, questions?
Mayor, the first question comes from Sia Nakor from WOIO. Will Mayor Jackson get the vaccine when it is available in Cleveland? If yes, when? If no, why not?
The question is, will I get the vaccine? And if yes, when? If no, why not? Yes, I will get the vaccine, and I will wait my turn. So whenever it's my turn, then I'll get my shot.
Mayor, the next question is from Taylor Haggerty from WCPN. The new stimulus package does not appear to include funding directly for local governments. Where does the city stand financially without additional assistance?
Well, the question is, the new stimulus package coming out of Washington does not include state and local government funds. So where do we stand financially, I guess, in the midst of all this? We're finalized. I just had a conversation with my finance director earlier today, and we're finalizing the budget for the rest of this year. We will be balanced out this year, and we will be presenting a balanced budget next year. That budget will, however, have a reduction in revenue associated with more about the actual amount of revenue we collected this year. We know that the cost will be probably exceed that revenue. So we're looking at how do we carry over enough money to fill that gap into next year. So it won't be as structurally balanced, but it will be balanced financially according to the law. Now, in the midst of all that, we are building this new infrastructure in terms of setting this up for the vaccine, which will call for us to have to spend money that we had not anticipated. But that being said, we will set this up, we'll move ahead, and then as our anticipation and hope is that next year there will be additional money coming into state and local governments. And just as it's been done this year, it will be applicable to costs incurred as a result of the COVID-19, which will help us cover the cost of setting up this new infrastructure. So that's where we are.
Okay, the next question is from Cameron Fields from Cleveland.com. How many vaccinations do you expect to receive in the city from Pfizer and Moderna this week and next week?
The question is how many vaccines we expect to get this week and next week, Director Commissioner?
So a number of vaccines or doses that we're receiving will be from Moderna. We are in receipt of 4,000 doses.
The next question is from Eric Biggs. Why are we not making companies in Cleveland report the COVID cases to their employees due to having families that can be exposed?
Well, I don't know if that's something that the state is requiring or not. I know that we're not requiring it, and the question is, why are we requiring employers to report to employees that they've been exposed, or that someone, I guess, in the company has COVID virus, and why aren't they telling everyone else in that company? I don't know. I don't believe that we have that as a rule. We do not have that as a rule, and the question is why, and that is that we leave that up to the companies, and because we get information as to who has been infected, and then we do our verification of that, and then we do the tracing of that, and do we report that to the company?
Well, no, we don't. There are times when we do. So there are times when we are in correspondence, communications with those businesses with positive cases. And for those, we do direct them that it would be good practice for them to communicate in some way that they are experiencing or have identified positive cases in their facility. It's not a requirement for us, but we do advise them that would be somewhat of a best practice for them.
And so that you know, when we do our enforcement and we find out, particularly if it's an entertainment venue, like bars or restaurants or things like that, and we find that there's either someone, a customer who has been infected, or an employee who has been infected, we then say to the owner of that establishment that they have to close until they sanitize their establishment. And once they demonstrated that they have sanitized it, then they're allowed to reopen. But as director said, we encourage them, but it's not mandated.
Okay, Mayor, the next question is from Jordan Vanderberg from News 5, and he actually stated he had a question for Chief Williams. Last week, you told City Council Safety Committee that 160 officers have been out the past few weeks because of COVID-19. Now, 3 more officers are on restricted duty because of pending criminal cases. How would you characterize the current staffing level at the Division of Police?
Well, the question is, wanted to direct it to the chief, and since he's not here, I'll attempt to answer your question. Is that last week at council, the chief said that there was 160 officers who were out in some COVID-related thing, and that there are 3 officers on restricted duty pending some criminal charges. And how do we view our staffing in order to deal with whatever is going on in the city of Cleveland in terms of police? It's a challenge, just like anything. Imagine if you went to the hospitals who, just one of them, is my understanding, has over 1,000 people who are impacted by the COVID virus and COVID-19 virus, and they are unable to come to work. And as a result of that, the people who are coming to work are many times working double and sometimes triple shifts in order to do the work. So the same thing applies here. You get the job done with the personnel that you have. If it were not for the COVID stuff, COVID-19 infections, then that mean 160 officers would be on the job. In terms of 3 who are under some possible criminal charges, that's a drop in the bucket, and that wouldn't make that much of a difference, but 160 does. But we just step up. The same way a business would step up if they were obligated to perform on goods and services based on a contract. They would have to step up in order to meet that obligation. The same with the healthcare industry and hospitals and medical industry, when they have people who are affected and they're down, again, with one hospital, at least over 1,000, they have to step up. You just have to do what you have to do. It's no different than for us. We just step up and do what we have to do. Or is it better to have the people? Yes. Is it less efficient because you don't have it? Yes. But that doesn't stop the show. You still have to perform.
The next question is from Connor Morris
Will the city of Cleveland be shutting off the water or electricity of Cleveland Public Power or water customers during the winter months if they are behind on their bills?
Yeah, I think there's a policy in place around the winter months. I'd have to check on that. There may be some policy around not doing shut-offs during winter months. I don't know for sure, but I'll check on that. But if you're also referring to the fact that we sent out notices on December 1st to people that that it's time to pay your bills, and that those who are eligible, we are referring them and helping them go through programs where there are dollars available to help pay for those bills, those back bills, and to get on programs if they have income eligibilities and they meet that, on programs that would help to minimize their bills going forward. There are many people who were we reconnected who had not paid their bills even before COVID, whether they were in Clean Public Power or the water bills. These were people who were just not paying their bills even before COVID. What we decided to do then is just to reconnect them, whether they had been pre-COVID or not. But those who lost their income or unable to pay because of the COVID, then we work with them to help them catch up. And then if they're still unable to pay, then we work with them to identify programs to help them pay. And as we look at this and we review this on a monthly basis, you know, we may alter that one way or another, but right now we're in the mode as I just mentioned to you.
The next question is from Gerard Henderson. If the flu numbers are so low, how is the COVID numbers high?
Well, you'd have to, if the flu numbers are so low, how is COVID so high? You'd have to talk to a doctor for that or epidemiologist or somebody, but I would suspect that the flu numbers are down because people are wearing these doggone masks, they're washing their hands, they're keeping social distancing, you see, and they're cleaning their surfaces, they're cleaning. So that helps to prevent the flu. But the virus is a different creature. It is more aggressive and is more infectious. It's easier to catch it. So I would imagine that just following the basic rules to prevent the spread of the virus has a significant impact on people getting the flu. Would you?
That's absolutely.
And the director says I'm right.
The next question is from Robert Matthew Corby. Will the city of Cleveland be transferring additional funds to Cleveland Housing Network so that they can accept applications again?
The city of Cleveland, will the city of Cleveland be transferring funds to Cleveland Housing Network so they can take applications? This goes back to the question about your rent, a water bill, sewer bill, electric bill, all of that. We put money into that in order to help people make it through the COVID if they've lost their job and they don't have income, to help them work through this. And the question is, will we provide additional money to Cleveland Housing? We will provide money to help people. I'm not saying we're going to give it to the housing network. We'll give it to whoever it is that can perform the job. And so the housing network was the vendor that is working, I think, on the rental assistance. And I believe that they're also doing something around utility bills. And we will be evaluating them not only in terms of the number of people that they dealt with, but also the quality of that work, whether people have fallen through the cracks. And if they have not done their job, we'll find another vendor. If they have done their job, then we will work with them as additional money comes in. We will work with them to continue what they're doing and may find additional vendors also to assist in that, depending on what the demand is and what the housing network's capacity is. One of the issues that came up most recently that is all related to whether or not we're going to do cutoffs and whether or not people are going to access money, is their ability to have the capacity to process the number of applications coming in based on what they have to do to draw down money, not just from us, but from the feds or the state or whoever. So we're evaluating what their process is and whether they have the capacity to perform at the level we would like it to be.
The next question is from Cameron Fields from Cleveland.com. With some vaccines already administered last week, how many healthcare workers in the city of Cleveland have been vaccinated?
How many healthcare workers in the city of Cleveland have been vaccinated? I do not know. That would be a question you would have to ask the Cleveland Clinic, University Hospital, Metro Health, and Sisters of Charity. They would let you know how many of they have vaccinated, and they would also probably be able to tell you how many of them refused vaccination too, if they would choose to tell you that. But you would have to ask them in regards to that. We can report out once we go through this. We're going to start on Christmas Eve, and I think it's a 6-day operation where we're scheduling all our paramedics and EMTs to come in our first phase, and we can tell you how many we have vaccinated out of how many. You know, if there's X number, how many of that number actually came in and said they wanted the vaccination. And so we'll be able to tell you that. And then as we go out and we deal with the second part of this and identifying those congregate living situations where they did not register to get the help from Walgreens and CVX, then they're falling back on us. So we have to identify who they are and begin to work with those organizations and see if we can get their people vaccinated. And we know that there's probably about 2,000 or so people who are eligible in those areas that have not registered as they should have with the state that we'll be responsible for. And so we're putting the infrastructure together to identify these agencies and how do we get to them and vaccinate their people, and who would want it and who would not want it.
Okay, Mayor, this is the final question from Ariel Weisenberger. Do restaurant workers have the right to refuse service to people who come in without a mask, or to people who come in saying that they have had the COVID because they could still be spreading it?
The question is, do restaurant workers have the right to deny service to people who are not wearing a mask or have communicated that they have been infected, even though they may not be displaying symptoms? I assume that's what they mean. If I was a restaurant worker, I would certainly do that. Now, what their boss would do if in terms of them refusing to serve that person, that's another question of which we do not have any authority over. Director, is there any rules in regards to that? There's no, pardon me.
So, right.
Go ahead.
So in our local ordinances, we do have rules regarding service in public establishments right now under the emergency authorizations, and those are in place. So masks, wearing a mask until you're seated, those are the pieces that we're currently doing. But whether a business can refuse service, businesses have the right to refuse service to anyone. That's a longstanding sign I see posted when I walk into places. It's their business. We try to give them the best public health information and the guidance on that, how to help their customers and their staff stay safe. But that's where we kind of have to draw the line.
And on that point, not that point, but in the general context of what was asked and answered, is that we're extending the mayor's emergency, the mayor's proclamation to the end of January. So I signed that today. And as you know, we do it month by month, depending on what's going on. So it's basically an extension of what we've have had in place going in the past. We now have extended it to the end of January. And it's in line with what the state is doing, the governor's mandates, and also our local ordinances and mandates around establishments and masks and all that other stuff. Any other questions?
Yes. There are a couple more coming in. The next one is from Damon Appel. Why is the city of Cleveland not emphasizing the dangers of taking rushed vaccines based on mRNA technology, which has never before been released to the public anywhere at any time?
The question is, why isn't the city of Cleveland, I guess, advocating the danger of taking a vaccine that this questioner has says has been rushed and based on new technology, mRNA technology and approach? Why are we doing it? We're not doing it because someone has to have some confidence in the process and that we're in the middle of a pandemic and people are dying every day, if not in Cleveland, somewhere. And emergency rooms are full, the intensive care units are full, and this vaccine is going through, even though an expedited process, it has gone through those levels of approval that have demonstrated the safety. Now, I will say this, where the questioner is absolutely right, that it's demonstrated safety in terms of the short run, and that in terms of short run, that those who are part of the trial and those who have received the vaccine have some minor side effects, but there's no major reaction from the vaccine. But that's in the short run. You really, to the questioner's point, you really won't know about the long range effect of this for another 3, 4, 5 years. And if there is something based on this new technology that has been researched for years, is my understanding, but this is the first time it has been used in terms of a vaccine, this mRNA technology or approach to life. There's no real understanding as to what the long-term effect would be. So with those two things out there, and the fact that, like a man told me the other day, and I know this is related to just a small group of people, but the man told me he was 93 years old. And I said, well, are you going to take the vaccine? He said, yeah, I'll take it. I said, well, you know, they can prove the short-term benefits, but there's no proof yet of the long-term, whether or not in long-term there's side effects. He said, I'm 93. And if it takes 7 years for me to get a negative effect, I'll be 100 if I'm still around. So the sense of urgency with him was, give me the vaccine. I'll deal with the long-term stuff later on. And there are a lot of people who feel the same way, even though they may be younger. They may be younger. They may say, you know, I know short-term I'm okay. I don't know what the long-term effects would be, but I do know that I know somebody who has died from this. I know somebody who has been infected and they have long-term complications where they're never the same again. And so that's why we give people choices. If you don't want to take it, that's fine. And that's what we do. I'm not advocating, saying that this is dangerous and you shouldn't do this. I'm not a scientist. I just know what I just told you. That's what I know. But I'm going to take it, and I'm going to deal with whatever happens as a consequence of me taking it. But I am going to take it because it is the proper thing to do and the right decision at this time.
Next, from Carla Wathers, is the city working with city transit in regard to enforcement of wearing masks while
Are we
driving?
working with RTA in enforcing masks. I imagine if they asked us to, but they have their own police department and they have their own enforcement mechanism. So I would imagine that they would, if they were having some difficulty with a passenger who was not wearing their mask, they do like they would do anytime. If they have some difficulty, they